It's fantastic to see the ever-increasing vaccination rates across the state, which is very important for us to conquer this and live with COVID. With the numbers, there have been 1,218 locally acquired cases of COVID reported in New South Wales to 24 hours to 8 o'clock last night. In addition, there were 3 overseas acquired cases. There were 106,038 tests reported to 8 o'clock last night, compared to the previous day's total of 129,182. Unfortunately, we're seeing large numbers of people in hospital with COVID. 813 people are admitted at the moment with COVID into New South Wales hospitals, including 126 in intensive care and 54 who require ventilation. Of those 126, 113 were not vaccinated and 12 had received 1 dose of vaccine. Sadly, as the Premier mentioned, we've seen 6 deaths of people who've had COVID. A man in his 80s from southwestern Sydney died at Nepean Hospital after acquiring his infection there early this month. He's the 5th death linked to the outbreak at that hospital. He was not vaccinated. A man in his 80s from Sydney's inner west died at Concord Hospital. He acquired his infection at Wyoming aged care facility, and his 5th death linked to that outbreak. He was not vaccinated and had underlying illnesses. 2 men in their 70s from southwestern Sydney died at Liverpool Hospital. A man in his 70s from Western Sydney died at Westmead Hospital, and a woman in her 80s from Western Sydney died at Westmead Hospital. I express my deepest sympathy for the families and friends of these people who have died. We continue to see the highest rates of cases in Western and southwestern Sydney, but other parts of Sydney, of course, are also affected, in parts of Western New South Wales and the Hunter. Where suburbs with most cases and we're most concerned about continue to be around the areas of Guildford, Merrylands, Auburn, Greenacre, Bankstown, Punchbowl and Blacktown. Our ongoing sewage surveillance system has detected some further pings or positive fragments in some places where we don't have identified cases in regional New South Wales. These include Trangie, which is just west of Dubbo, Byron Bay on the north coast, Temora in southwestern regional New South Wales, Cooma and Tamworth. We're concerned that there may be cases unrecognised in these communities, so please come forward for testing if you have even the mildest of symptoms. We want to make sure that you're cared for, but also your family and community are protected if you do happen to have COVID. We've also seen positive tests in Toukley on the Central Coast. We continue to be concerned that everyone on the Central Coast is aware to come forward for testing if they have the mildest of symptoms. In Western New South Wales, yesterday we saw 2 new cases in Wilcannia, and in Dubbo, 18 cases, Burke 2 and Narromine 3 cases. Thank you very much.